The drug traffickers saw a shift in demand. And although they're criminals, they're very savvy business people. And they have adjusted their product to fit that new demand. And why was there a shift in demand? And I would submit to you that a major factor has been the literal explosion of painkillers being prescribed in our state and in our nation. Let me give you some numbers. In 1997, there were, for every man, woman, and child in Ohio, 7 pain pills prescribed in that year. So that's, you take the population, you take the number of pills prescribed, you divide it, you get 7 for every man, woman, and child. Now let's fast forward to 2010, just a little more than a decade later. In that year, for every man, woman, and child in Ohio, there were, wait for it, 67 pills prescribed. That is an increase of 900%. And I'm pretty sure that the level of pain in Ohio did not increase 900% during those years. Any way you look at it, the pills get expensive. And what happens is people either run out of the pills or they run out of money. And what do they do when that happens? What we found is that they turn to heroin, which is in the same pharmacological family. It's also an opioid, which they can get for a fraction of the cost and much easier than they can get Percocet or Vicodin. In Cuyahoga County, just to the north, heroin deaths have increased 400% in the last 5 years. Last year alone, 1 year, 200 people died from heroin overdose in Cuyahoga County. And Summit County, as you know, has its own issues. In the last 2 years, there have been 41 and 45 heroin overdose deaths, respectively. That's 86 people. That's 86 families, 86 fathers, 86 mothers, countless brothers and sisters and friends. Just this week, just today in the paper we saw, 5 people have died from heroin overdose in this city. These are tragedies. And these tragedies, these fatalities, they cut across all demographics. I will tell you firsthand, and the law enforcement officers here will tell you firsthand, Chief Nice is here, that when it comes to heroin, a gram of prediction is worth 10 kilos of cure. Because the grip of this drug is so strong once it takes hold that it rarely lets go, even when people go repeatedly back into recovery. Because we can cite numbers and statistics and try to get shock value all we want, but when a person you know actually deals with this issue, the number 1 is really all that matters, because 1 is too many. So we have this multifaceted problem. It's a problem that affects real people, and I submit to you, we need a multifaceted solution to the problem. The healthcare policy group had goals too, and not surprisingly, the healthcare policy group was dominated by doctors. And one of the things that they identified was House Bill 170, which is the bill that would allow first responders and families to get access to naloxone, which is this incredible antidote that can literally save the lives of people who have overdosed on heroin. Together, this group decided they were going to push for that to get passed. And there was some opposition to that at first, but through the will of that group and through constant trips that they made to Columbus, talking to legislators, the governor signed that bill into law. My office does hundreds of these cases, but they will tell you and I will tell you that we cannot arrest our way out of this problem. The solution cannot just be to arrest drug dealers, although that's part of the solution. The solution cannot just be to have more treatment beds, although that is part of the solution. The solution cannot just be to require doctors to see if a patient is doctor shopping, although that might be part of the solution. And the solution cannot just be to get in front of every parent and teacher and child and tell them that making the mistake of trying heroin might be the last mistake they ever make, although that is part of the solution. We need an all-of-the-above approach: law enforcement, treatment, to get control of the stream of pills, to come together as a community and educate people to stop experimenting.